Welcome, everyone. I see people coming into the webinar. It's nice to have you this evening. And if you're watching this later, I'm glad that you're joining us virtually. That's the benefit of technology. I'm Dr. Scott Stoll, co-founder of the Plantrician project. And before we kick off tonight, I just wanted to highlight the PBNHC conference. This was the first conference that we launched in 2013 that really started the Plantrician project. And it is a conference that's built around the evidence of food as medicine, whole food plant-based nutrition to prevent, suspend, and reverse disease. But we built the conference really to cultivate a community of leaders in healthcare. And the way we did that, we decided that we would have one room with lectures where we all sat to learn the same information. And more importantly, that we would sit around tables 3 times a day, eat delicious food, and meet amazing people like my dear friend Columbus and all the other people that we have met through the years. And we've had, I don't know, gosh, maybe 6,000 to 7,000 different people come through our conferences in the last 12 years. And around those tables, we have had research projects started, books written, lifestyle medicine centers imagined and realized in healthcare facilities. So many things have started around those tables in conversation. And so I really want you to join us this year. PBNHC, we have had amazing signups thus far, and it's likely that we may sell out this year. So make sure that you get your ticket and join us at PBNHC at September 5th through the 8th at a beautiful resort, JW Marriott in Palm Desert, California. It's a perfect time of year to be there. And this evening, my dear friend, my brother, Dr. Columbus Batiste is joining me. If you don't know Dr. Columbus Batiste, you need to know Dr. Columbus Batiste. He is a board-certified interventional cardiologist, assistant professor, University of California, Riverside School of Medicine, regional chief of cardiology for Southern California Permanente Medical Group. He co-founded the Healthy Heart Nation, which is our beloved partner in this passion project for our HELP conference. Both he and his wife have worked with Tom and I and our team to host the HELP conference, and it is our mission and our passion to reach these communities that are at risk. Dr. Batiste lectures all around the world. He and I have lectured together in Saudi Arabia, and he also just came out with a fantastic book that you have to read. It's called Selfish. Jill's going to put the link in the chat, so I would encourage all of you to buy that book, support Columbus's work. And it's a beautiful book too, because it really looks at more of a comprehensive view of healing the broken heart. And you know, it is food, but it's also learning how to care for yourself in a meaningful way. And I'll let Columbus tell you more about that book. Columbus, welcome. I am just so happy to have you and delighted that we can have a conversation this evening.
Yes, thank you so much. It's always good. And thank you, brother. It's good to see you. Scott, you are indeed my brother. And I'll tell you, I think I vaguely remember when we first met at one of the conferences early on there, and such incredible work you and the team has done in building such an informative and transformative conference. It's touched so many lives, and I'm honored to have been a part of it on several occasions. So this is good. Always good to
Yeah,
connect.
thank you, my friend. Hey, before we jump into our topic tonight, tell us more about your book. I want people to
Yeah.
know your heart behind it and all that you've woven into those pages.
Well, I'll tell you, like many things in life, there's always like an origin story, and I think part of the origin story for my book really kind of was encapsulated with the patient that I encountered, and that patient also is part of the idea for help and too as well in part. And she was in her 40s, Caucasian female. We would now call her a frontline worker, and she struggled with her kids and dealt with a lot of stressors. And despite all the efforts of modern medical technology, she had repeated heart attacks and suffered with a broken heart syndrome on top of that before. And so all the different strategies of trying to adopt nutrition with her, I recognized just the importance of the holistic approach with her for really after the fact and during. And so as we began to kind of work through the components in her life, as best we could before she ended up passing away. And so with her as an individual, she's not the individual I speak of in this story. I recognize where the gaps were as a physician that I didn't provide to her. that I was focused on the pills, the procedures, the nutrition, trying to transition the lab tests, but not looking at everything that happens around her, the 80% of life that happens around her, and really is what health is built on. And so I began to address the spiritual aspect. And so spiritual, we oftentimes have a connotation that means just a religious, but spiritual means our meaning, our purpose, what drives us, what gets us going, that allows us to connect with one another. The E for exercise, the L for love in terms of forgiveness, forgiving herself and gratitude, the food as a central pillar, the I for intimacy of relationships, which is so important. The S stands for sleep or rest, and just the genuine power, transformative power of that. And H stands for humor, which represents the joy of life, and how each of these pillars really impact not only stress, but they truly do impact in terms of your heart health through, as I try and describe, through the mechanisms of pathophysiology of the endothelium and so forth. So it's a book from my heart. It's a book that I felt my patients needed. And I hope it'll be valuable to those who take a listen or read, rather.
Yeah, thank you. Or listen. Is it on audiobook yet or not?
It is on.
Oh, they can listen
audio.
to it. That's right. Put it in the AirPods. That's right. That's great. Thank you, Columbus. And this evening, this is a conversation between all of us. And so at the bottom, in the more section, you'll see a Q&A bubble. And if you would like to put your questions in there for Columbus, myself, we would love to engage in a conversation, because this is such an important topic. And really, as you know, Columbus, like, this topic is, it's a passion project that started between you and I several years ago after we did one of these education series on health disparities and inequalities in the United States and around the world. And I called you shortly thereafter. I said, Columbus, we can't just talk about it. We've got to do something. What can we do? And our first step was to start a conference that would bring together people to discuss, to ideate, to innovate actionable solutions that we can take into these communities at risk and help them, because they need desperate help. I'm just going to throw a couple of statistics out just to set the tone for the evening, just because I think it's so important, and to recognize, like, this is a global issue. It's in our communities, it's in our zip codes, near our homes, it's everywhere. 87% of the premature deaths in the world are due to non-communicable diseases in low and middle income countries. Life expectancy varies by 34 years between countries, and even within zip codes, the leading social determinant of health, it can be 20 years difference in lifespan and health span, just inside and outside. Access to supermarkets of unhealthy food choices, fast food restaurants, and the risks that disproportionately affect non-Hispanic Blacks. You often say, Columbus dramatically changes the one zip code, they found individuals in King County, Washington, had obesity prevalence of 6-fold across different zip codes, highlighting the influence of neighborhood, socioeconomic status, and built environments on health outcomes. PubMed underscores that, again, the various U.S. cities, the average life expectancies in these communities vary by 20 to 30 years in those neighboring communities where they have low access to healthy food, to healthcare, to supermarkets, and to education, like we're bringing. And disparities in healthcare infrastructure. This is from Health and Services Research. Zip codes in the most urban parts of America have the least hospital capacity, with the highest proportion of non-Hispanic Black residents, and they had fewer beds and fewer staff and lower quality care measures. And so it's we could talk about the statistics. It's a major problem, and people are suffering today. And so that's why we really wanted to start the conference, is to bring people together, to start discussing what can we do. Simple first steps. It doesn't have to be a grandiose plan. It can be just starting a potluck, which I'm going to encourage all of you to do now and at the end. So you'll get another commercial on this, but you can start a potluck with 3 people in a community where there's a challenge, and it's the most beautiful way to start bringing people together and educating them. So I've said enough, Columbus. I'm going to toss all of that to you so you can kind of set the stage, and then we can engage in a conversation, and hopefully we'll get some questions that we can also answer.
Yeah, no, thank you so much for introducing the topic, and definitely want to welcome those who are joining us here this evening. I'll tell you that when I look at this concept in terms of health disparities, or this idea of differences, that's all disparities means. It just means differences. And I like to kind of take a step back and be as objective as possible. Now, this has got me into trouble in my professional life. So administratively, I've been known as a guy who loves data and to prove everything. And so it's natural for me to take a step back. And when I look at this, as physicians, we're trained to make observations. We're trained to make pattern recognitions, to identify risk and assess risk levels on a regular basis. And so as we begin to look at the literature as it relates to health outcomes, we see that there are differences that definitely exist across the United States and have historically existed. But the sad part is that globally, on the global stage, we see that there is quite a stark difference in terms of health outcomes in America in general for all of us that are there. And so it tells us that there is a common thread, there is a risk that exists. And so as we begin to apply that on a smaller scale, we identify, like you mentioned, the disparities that exist according to race, according to gender, according to geographical location. We start to see differences that exist according to financial strata. And so it tells us that there is a lot going on. And one of the major underwriting issues is that of food security and nutritional security as a consistent staple. Now, there are many reasons. We begin the concept of identifying there are differences that exist. But now that we identify their differences, what are the causes? Is it causation or is it correlation? So we've made a correlation between the place that a person lives, right? And for health outcomes. But now what's so interesting is that the science is beginning to tell us it's not just correlation, that there's actually causation. And so what's so interesting, Scott? So I take myself, for example. I grew up inside of the inner city, inside of Compton, California, is where I grew up. And so Compton, California, historically was a very wealthy city years and years before. Has an airport, a college, all these different things. But at the time I grew up, it had really decompensated in terms of financial structure, lots of homeless individuals. We would have lots of noise from the airplanes, the trains coming by. We would have lots of plane crashes. We'd have lots of pollution. And so studies now have begun to give us the causation that the fact of what this plays on the endothelium and the stress levels that are increased inside of these socially, economically disparate areas that are there. You amplify that, these crucibles of conflict, with poor nutrition, and now we've lit the match of disease that begins to flourish and propagate continually. And so we see this. And so one of the things that I'm thankful for my wife, and I did not ever quite listen to her strongly enough, is she said, Columbus, I need you to quit focusing so much on the problem and focus on the solution. Focus on the solution, which is really, that's the beauty of our relationship. You said up front, you said, man, I as we develop this conference and really are looking at things that are impacting citizens of America in certain communities, let's focus and target what the solution is and how we can make sustainable change. And that's what's so beautiful about this. Now, we can't tackle education, pollution, the way automobiles and jobs and businesses and financial issues, but we can impact something that matters, and science tells us matters so much, which is nutrition and the foods that we choose to eat, the environments in which we live. And so that's one of the bases. I think that's the foundational aspect of why we've chosen to really address this. And this is the same message that applies to everyone, to be honest with you. It's the same exact theme. It's the good guys versus the bad guys. We're just targeting a specific group, but the group really entails all of us.
Yeah, that's right. Thank you for setting that so clearly. I really appreciate the way that you brought in the causation, because it's easy to, to sometimes ignore things or to minimize them because we just say it's only a correlation, but it's not really happening. But in reality, it is happening, and there's a direct causation. As you said, the environmental stressors, the epigenetics that are passed on to the next generation, and then, as you so eloquently said, the food lit the match, and that's absolutely what happens. You have this stage that is set for chronic disease, and then you add in all of this calorie dense, processed food that just absolutely lights up the disease in the body. And then they have poor access to healthcare. They don't have the finances to make changes, and so it really creates this, I'm thinking of California and the La Brea tar pits, right, where the dinosaurs and the woolly mammoths got stuck in a tar pit, they could not get out.
Yeah,
in many ways, that's what these communities have become. It's like the La Brea tar pits. People are stuck and they can't get out. And so it's, I feel it's incumbent on us to be able to go in and throw them a rope, pull them out, and help rebuild some of these communities in a meaningful way. I was just remembering, as you were talking about simple solutions, there was a study recently that came out. Dr. Kim Williams was telling me about this. They measured CRP levels before and after. They went into a community and they just simply planted trees. They planted a whole bunch of trees in a community where trees did not exist, and then they followed up with CRP levels after the trees were planted, and there was a significant decline, statistically significant decline in CRP levels.
Absolutely. It's amazing. Simple things like that. And that reminds me, I was listening to a podcast, and I listen to a lot. I'm a sports addict. And so there was an athlete who was on, and he was talking about growing up in the inner city, and he had always kind of been there. And even though he was wealthy, he still lived in the city. And he went to a celebrity's home, and he said, "Man, I thought I was in heaven." He had all these green parks and trees all around. He said, it was just so peaceful. And that's the key. He said it with jest, but the reality of it is that there's such a calming nature calming effect when you go into nature. And something simple that has been shown beyond multiple times, not just solely C-reactive protein, for those of you who know, is a marker of inflammation, that's predictive of adverse cardiovascular events going forward in the future. It's one of our strongest predictive measures that we have. But studies have shown that we also reduce our cortisol levels, that our perception of stress goes down when we're in an environment of nature and the green spaces that are there. And there's a direct correlation between the amount of green spaces, seems so simple, and as well as in terms of outcomes and disease as well.
Yeah, it's so powerful. And so, these communities, many of them are urban. We have to find ways to bring the green in any way possible. And there are lots of ways to do this. We could talk about some of those this evening. We have a question here, Columbus, from Connie. She says, "I'm beginning my whole food plant-based health coach mission with the same passion as yours. I live in a bit south of Boston. I'm trying to find the best place to work to find solutions in that area. So we'll try to help connect you. Connie, we do have our dilemma of giving processed food. Okay, yes, I get your question now, Connie. This is great. So Connie's bringing up the really important point, and that oftentimes food banks are loaded with processed food. And I worked in food banks, going back decades, in churches, and I saw that we were giving boxes of just garbage away to people. And I did missions work abroad, and I remember, vividly being in Haiti, and we had a little box of medications and a line of 700 people waiting to see us as we're sweating under these tents. And I look in the line because I was shocked at the number of people that had diabetes and hypertension and heart disease. And I said, well, how is this possible? And I looked down the line, and they're drinking Coca-Cola, they're eating chips, they're eating candy bars. And so they had food insecurity, And
Yeah.
it was solved by the West when we sent in truckloads of processed food.
Yeah.
And so it was a temporary meeting of hunger with calories, but we created an even bigger problem. Not only illness, but now dependence on Western physicians to come and deliver medications for the medications that, diseases that we were igniting with the food that we were bringing in. And so, in the past, we also started a food outreach in a parking lot with a church where we just brought in a truckload of organic produce and we set it up just like a farmer's market. And we gave people name tags because most of the time the people don't give them name tags. They only give them a box.
Mm.
Taught them about food. We saw children try blackberries for the first time in their life. We told them how to cook things. We gave them recipes. And we tried to invest ourselves in the community in a meaningful way with conversation and assistance along with the food that we were bringing. So, let's talk a little bit more about how this processed food has become the easy solution, but it really is not the solution for these communities.
Yeah, no, absolutely. And just to kind of piggyback on the food insecurity and issue and when we look at food insecurity, which is the absence of food, many of us we think in terms of the fact that, well, there's no food whatsoever. Well, there's food, but we have to look at the definition is not just about food-like substances. The issue is there safe and nutritious foods according to the FAO, right? That's what we're really looking at. Is there safe and nutritious food beneficial for normal growth and development? And are individuals able to get that? And so we see an absence in avoiding that. And that can happen in many sectors. And so when we look at the overconsumption of processed foods, we have to understand that the business of the food makers is just that, a business to make money. And it becomes very convenient. And that's a very complex history when you dig into it. There's wonderful, masterful books that have been written as it relates to the history of the evolution of processed foods. Even looking at the evolution scientifically from MREs, medical military rations, and so forth, and then going all the way into the construct of it that's happened. There's things like Supersizing Urban America books out there. There's other books, Michael Moss, Salt, Sugar, and Fat. There's multiple books out there that really point and they provide such a wonderful history that gives you a background. Essentially, what we know, right, fast forward to 2025, is we're flooded in America with ultra processed foods. And what are ultra processed foods? These are foods that have shelf life, they have staying power, that melt in your mouth, not in your hands, right? It doesn't require you to chew. They have the fiber extracted, the water is extracted. They're foods that you can't construct inside of your home. And one of the things that I think is so important when we're looking at the food and what's delivered out there is figuring out, can we make food? I'm going to bring it back full circle to a patient I had, Scott. I never forget when I was early inside this process of delivering the message of nutrition, the power of nutrition to my patients. And I interacted with this man. I was on the high. I had just, I had read the books, I read the Ornish, I read the research from Pritikin, I read Esselstyn. I was ready to go. And this is very early on within the first year or so. And I'm telling him, okay, whole food, plant-based, we're going to minimize the oil, we're going to go in hard. And he stopped and looked at me and said, Doc, I live in a 100 square foot apartment that have roaches. And he said it, and I stopped in my tracks, and I was just like, Columbus, what are you saying? And I said, okay, let's start over. All right, here's how we're going to approach this. And it was a birthplace for my concept of making convenience work for us. That means I said we're going to look at BPA-free canned beans. We're going to look at frozen vegetables. We're going to look at things that have been convenience, but yet they can be sustained and they're healthy for you. They are flash frozen. And so we began not only crafting meals that he could make in his microwave, but also looking at things that he could making better choices when he had nothing. He was out on the road doing work that he could go in, and we went through every restaurant, every place where he would be able to make the best choice possible to reach him where he's at. And I think that's a key when doesn't matter who we're speaking to. at what financial strata, what racial background they are, is meeting a person where they're at and taking into account their financial situation, not being afraid to ask that, their cultural situation too as well, their family dynamics, which plays such a substantial role. I'll tell you about another patient in a few moments. And I think that's what can resonate with people because they feel heard. They
Yeah.
feel heard and they feel empowered that they can actually achieve it. It doesn't seem so far reaching.
Yeah, that is so well said. And I know everybody that's watching, this is a cardiologist that should be the standard for cardiology across the world. Columbus, the way that you approach people, with your heart, trying to address all of their heart issues to make their heart healthier is incredible. And I just want to honor you for that.
Thank you.
And I want you to, when you share your next patient, I also want you to just share with the audience how you teach patients to have to create those really easy, sustainable meals. I mean, you've done such a great job like with Buildable, but maybe lay out kind of your blueprint because I think it's brilliant.
No, thank you. Well, I wish I could say I came up with it, but I probably have eaten in places. And as you learn, any of us who've been on this journey of trying to eat healthy inside of an environment that's not always conducive for it, we learn how to miss and match things. We learn how to put things together. And that's essentially what it is. The shift in the mindset is where I walk patients through. And the easiest approach that I tell them is indeed building a bowl because it's the easiest one. It's a low hanging fruit of starting with some form of a grain. It could be cauliflower rice, it could be quinoa, it could be brown rice, white rice, black rice, whatever it is. It could be a potato. It could be shiitake noodles. And then you're then going to add in, okay, I'll add in some legumes. Let me add in my beans, black beans, red beans, lentils, whatever it may be. Let me then begin to add and stack on that bowl as I'm building it out according to your taste. It could be a Latin bowl. It could be, an Italian bowl. It could be whatever it is. Don't have to be afraid of carbs, right? We don't want to eat garbage. We want carbohydrates. We don't want the garbage, of chips and fries, but we want the potatoes robustly with a nice robust chili and have all the good things there inside of it. And so once folks recognize that, and I'll never forget taking a surgical colleague, he's a trauma surgeon. And so we've known each other for years. And he was saying that he was struggling and wanting to try and do better. And he wasn't quite on this pathway. So I met him. We went down to a local grocery store. I won't call out the name. And I took he and his wife is an OBGYN, and we start walking through. And I said, okay, Jason, this is what you're going to do. I said, look, you got your bags of salad here. You got your pico de gallo. You have your sausage. I picked out all the things. There's a little guacamole. I said, you're busy. You're on the run. I said, okay, go to the frozen section. There's frozen rice here. Here's your canned beans. I said, we're going to build bowls. He was like, oh, yeah. I said, it doesn't have to be hard. I said, you can get this. I said, you can throw it together really quickly in your glass bowl, package it, take it to work, and you're good to go. And so there's so many options that are available to patients that are out there. But the problem is our mind is locked into what we're used to. And we have to unlock the door and open up the mind that there are options and opportunities that are hidden. And so we begin that process of working through on very simplistic approaches towards eating healthy.
Yeah, that's brilliant. Thank you. And I saw Jill put in the chat some links on how to build a bowl.
Yes.
Columbus said it can be very simple. It literally is buying a bag of greens, buying some cans of beans. You can buy sweet potatoes or potatoes, maybe some shredded carrots, some cabbage, and you get a handful of spices, Asian, Mexican, and you spice it as you cook it. And that's why I do that often too. If I'm alone, I just throw a bowl together.
Yeah.
And to beautifully get everything you need in that bowl, and it's literally done in 15 minutes, faster than you would wait in a line in a drive-through and get your food and eat it. You can actually make your healthy food at a lower price.
Yeah.
I just want to add in too, because price is important, right? And especially in these communities. So I want to make sure that we talk about that as well. because it's a very important reality for people that some of these foods can be expensive. Although there have been some large meta-analyses that have come out recently looking at plant-based diets and have found that they are between 16 and 30% lower on average in cost when we're doing a whole food plant-based diet. Still, these foods are more expensive than top ramen and some of the other foods that may be available in these communities. But with the growing rate of fast food today, as I understand, McDonald's is not cheap either. Can of beans is going to be less than the hamburger and fries. So why don't you talk through some of the things you've done to help mitigate some of the cost for your patients?
Yeah, and that's where it gets complex and one of the aspects in terms of the history. And there's lots of information that's written on why some of these foods are more affordable in terms of fast food and some of the processed foods that are available to our SNAP patients or those who are getting subsidized foods. They be success to them. But one of the things that when we look at the cost, you have to understand that there is a gradation. The least processed, which means it's inside the ground, you go and pick it, costs the least, right? If you grow it. The more that you chop and it's ready for you, you have to do less, the higher the cost is. And that cost increase to when you're going inside of a restaurant and you order carrots and spinach, you're like, well, I'm paying all this money for just this. That's where the cost just astronomically increase. So as you move towards the maximum convenience, that's where you're going to take on the most cost. So a bag of beans in a barrel is hardly anything at all. Your rice and your grains are not going to cost a lot when purchased in bulk. Your vegetables, when they're, you can purchase those even at various stores that may only cost 99 cents or $1. I don't want to call out brand name stores. You can purchase actually foods that can actually begin the process of providing a meal. One of the key things that where I talk to patients about is ensuring that they don't allow themselves to get hungry, right? And that's really an issue of food security is really hunger. And we look at Maslow's laws of need. And this is something you reference, and we look at those who are homeless and those who are in need, and they're given things that are less nutritious for them. But at that point, their mind isn't thinking of nutrition. Their mind is thinking in terms of just being satisfied and having something that's going to cut the hunger that's there. And they're given foods that don't necessarily fully cut the hunger because it spurs on future as we understand. And so we have to be able to provide nutritional security to individuals, not only providing them foods that are culturally relevant, but also foods that are going to provide nutritional support for them. And that's really what we're speaking about. And so, yes, we identify the fact that I buy frozen rice. I do understand that it costs more than the grain rice, but I get lazy at times. Now, thankfully, I have the ability to afford that for my patients who don't. We talk about batch cooking. And so in my former role, when I was a local and I was seeing patients in clinic, I actually started a cooking class. And part of that cooking class, what we would do a two-part, I didn't participate in this part. We would do batch cooking. We teach batch cooking in terms of using a crock pot or using an old-fashioned pot and making your rice that's there that now you can partition out, making a batch of beans, of red beans, of making various things that could be staple, a simple sauce that's low in calorie and it's nutritionally beneficial for you, and recognizing the power of spices. So, Scott, you spoke about spices as an aside, but I want to tell the audience out there, especially for those inside of different groups, whether or not it's a Latina group, or if it's African American group, an Asian group, there's all variable spices that are used that are part of a culture, South Asian group, turmeric, that all have such tremendous benefits in terms of antioxidant power, of having medicinal benefits for you. And as we begin to add in the garlic and the onions, which are from the allium family, that begin to decrease the platelet stickiness and help support the endothelium and spur on your gut bacteria that's there, or the turmeric and the curcumin that's there that's working as an antioxidant for you. These are all in an immunosuppressant. All these things have such value in terms of it. So that means that a person's culture, we're telling them the fact that there's power in your cultural foods. We don't want you to move away from your cultural foods. We want you to maximize the things that are health promoting or beneficial for you, and avoid and skip over the American style foods that have been made and have been processed and manufactured for financial benefit. And that's some of the main things that I oftentimes address.
Yeah, I love with this message, and I always try to elevate the traditions of the people. Wherever they've
Yes.
come from, their traditional foods, if you go back far enough, were amazingly healthy. It was generally plants, lots of incredible spices. They were connected to the growing of food in all of these cultures around the world. And so this is a wonderful opportunity to not only bring a message of health and healing, but to help them reconnect with their traditions and be proud of those traditions and the food that held those communities together for so many years.
Absolutely.
We've
You
got a
know,
good
we,
question. Oh, go ahead.
oh, no, please go ahead.
And it's I, there's a good question. It's a good conversation. I'll just read it from Jennifer. She said, "I teach science nutrition in a prison where many individuals come from communities disproportionately affected by incarceration. Once inside, they are faced with a food system that offers little more than highly processed, nutritionally poor options, further reinforcing cycles of chronic disease and poor health. And as you and I know, neuroinflammation, depression, anxiety. My students are eager to make better choices when they learn about nutrition, but the reality is their options are severely limited. I focus on helping them navigate these constraints by choosing the lesser of evils, yet true systemic change remains out of reach. Education is a step forward, but without better access to nutritious food, the cycle continues." And I was going to mention to you, Jennifer, I have a friend that I've worked with a company doing some advisory work in Massachusetts called 2445 Organics. And they have growing trays, and they now have a contract with several of the prisons in Massachusetts. And they're bringing in growing trays to grow healthy, nutritious food inside the prisons. And that to me is like the most powerful solution, because they're actively involved in the process of planting a seed in the soil, cultivating something that's alive, and harvesting it for themselves. And then when they have an abundance, they're also sending it outside the prison, knowing that they're positively impacting someone else. And when we think about, how to change systemically, that's perhaps an easy step to, begin making some of those changes inside the system. There was I think it was actually managed by maybe Seventh-day Adventist Columbus. You can correct me if I'm wrong, but there was a prison, right, in Southern California. You go ahead. Why don't you tell that story?
No, yeah, no. Go ahead. We were tell you, great minds think alike.
We're synced.
That no, it's so amazing when you think about the power of this story. And so what this group did, he purchased a prison, and essentially cutting to the chase, he decided that he was going to opt for feeding individuals a whole food plant-based diet, a vegan diet, and they got to choose those who decided to stay on the normal fare in the prison versus those who were adopting the whole food plant-based diet or vegan lifestyle. And it's just amazing. All of a sudden, there were the gang fights dropped off. All of a sudden, all of the wars and the racial tensions began to decrease that were there. And applying these principles, they then went on and found that the recidivism rate was extremely plummeted to almost
It was
nothing
opposite, right?
whatsoever.
Like today,
Yes,
recidivism is 90%.
yes.
There it was like 10%. I mean,
Yes. Just incredible. And they were shut down over an unpaid telephone bill of some sort, is what I recall from it. And there are still individuals who are living healthfully after going through that program. And it kind of tells you the power as we begin to reshape the diet, the nutrition, we're reshaping our mind too as well. And we're opening up. And I've seen that time and time again. Many of you, I'm sure, have experienced it and or have had others tell you, is that how there's clarity of thought, of how all of a sudden, folks begin to transform when you get all these toxic chemicals out your system and you're no longer having it on a regular basis.
yeah, thanks for
Yeah.
sharing. That is so good. And some of these systems are going to take a while to change, but I just want to appreciate you, Jennifer, for teaching, these people that are really struggling, the foundations of nutrition. And at least when they leave, or they can even share it with their families while they're there, you're making a difference. Even though the system doesn't support you, you are making a difference. And that's what that's part of our vision for Even Help is, we can't change the system. If we look at some of the core drivers of these terrible disparities, we can't change them. I can't change them. But lots of us doing little things can bring about immediate change where we are. And then we can also begin, those things start coalescing into a groundswell movement that works its way up and has, a far-reaching effect eventually on these systems. And, it's sometimes, despairing to look at a large system, even like the prison system, and think, what can I do to make this change? But Jennifer, you're doing something significant today, and I just really want to appreciate you for that.
Yes,
you are making a huge difference. Just keep doing what you're doing. Keep doing it, and we support you. And we'll continue to work as a group to encourage each other in these small changes. About the reference for the prison project, it's 2445 Organics is the group. And if you go to their website, you can read about some of the projects they're doing up there.
But I think that's powerful right there. And so this is really, you didn't intend to maybe tease into Help Conference, but that's exactly what Help Conference is. So Jennifer, you have a passion for I'll call it prison ministry, for prison education, and part of what you do in your ethos. And so coming together at Help, and imagine if now Scott mentions this group that's going in and they are doing the growing of foods and so forth, and you're like, you know what, I'd love for this to happen at my prison. And maybe now you have a contact where they're able to help make that happen. And now at this local site, you're able to advance the cause of delivering health and wellness to this disparate community. Now you begin to replicate that in multiple individuals who have a similar passion. Or maybe perhaps someone says, hey, listen, I live in a spot where there's a church and there's unused ground, but we have someone at the Help, and we're focusing on how a person can build community gardens, how you can build urban gardens. And now all of a sudden you get the idea, I would love for my church property or my place of faith to use part of their grounds for a garden. And so now you lead that initiative, and now you take that idea that you received from Help and maybe the instruction on how to go about doing it, and you're able to spur it on. And maybe the same thing in the educational system, maybe another thing in terms of setting up your potlucks that you're going to have in your community or within your social group that's there. And that's really what we're trying to spur our solutions. Not necessarily, we're not opposed towards grandiose solutions that can solve the problem, but we're also looking for just the core fundamental things that are grassroots. And I tell everyone this: if we were to go back in time, I don't know who's been plant-based, vegan, vegetarian for the longest, but if you go back 30, 40 years, did you see half of the stuff available in the grocery stores like what you see now? That didn't happen by chance. That happened because there was a demand for it from the people. That's the only reason why the manufacturers began. I'm not saying everything that they put out is helpful, but what I'm saying, though, is they did that because there was a demand for it. And the same thing will happen, the domino effect, as we begin to push the narrative of change, the seeds of change, and really planting those, and not just planting, but tilling the soil. So we not only want to plant, we want to till the soil and help you till the soil and fertilize it and help support. And that's really where the power is inside of coming together.
Yeah, thank you. That's right, Columbus. Yeah, it is. It's this is definitely a together thing. It's we're, as you mentioned, we are going against this very strong cultural current. And I often think about the cultural current like the Mississippi River. If you just hop on the Mississippi, there's a strong current, and if you sit there long enough, you're going to end up in the Gulf of Mexico. That's the cultural current of the lifestyle that we have today. It's easy. Yeah. But if you turn around and you start swimming upstream, you get very tired quickly. And that's why
Yeah.
you cannot do it alone. It's our patients need a community, they need support, they need doctors like Dr. Columbus Batiste and his team. And as healthcare professionals and people that are influencers in this space, we can't do it alone. And that's why we need a community of people. Plantrician Project, visiting the conferences, a community is really essential because we share things, we learn things, we get encouraged, we take things back, and we know that we're not alone in that fight. If it's a bunch of us on a raft taking turns paddling going upstream, that's much easier.
Yeah.
That's what we're trying to do with the help conference is we're all trying to work to paddle upstream together and bring about change and pick up the people along the way that need help.
Yes.
There was somebody here that asked Columbus, they said, where can I meet Dr. Columbus Batiste? She attended UCR as a major sociology. Where can I find Dr. Batiste on campus?
Well, I'm not. The last time I was on campus was for a panel discussion. I primarily I'm an adjunct clinical professor. I was helping out with the residency program and so forth. But I'm in the community, and I'm always happy to engage and do a lot of work in the community as well, on a regular basis. Would love to meet you.
That's great. Connie has a question. Have you found any solutions for simplifying healthy food distribution? I'm on a local committee where the disorganization of food is a common problem, overlapping of farms, trucks, sources. My goal is to streamline getting organic produce to those in need. My first thought, Connie, is that you can look up online. Dr. Megan Grega is a physician with ACLM, but she and her business partner started the Kellen Foundation in Bethlehem, Pennsylvania. And they've done an amazing job of creating a distribution channel from local farmers to inner cities through trucks and various means. So that is a wonderful model. And you can contact them and they can give you some additional information. That's Kellen, the Kellen Foundation, Dr. Megan Grega. And thank you, Jill. Jill is lightning on the keyboard. The Kellen Foundation
Yes.
there is in the chat. Thank you. Did you have anything to add to that?
No, I no that's yeah, they do amazing work. They do amazing work, and I think that's the collaborative nature. I keep bringing back to it is I think that's something that that Scott and I and Tom and Danette and so forth are really trying to go in and define out help and what separates it from other conferences out there. Yes, you're going to get the science behind things. Yes, you're going to have some of the world-renowned speakers that are coming through. But I think what's different is we also want to come together in smaller groups and have more practical, tangible actions in terms of solutions on a regular basis, where it engages discussion and thought on how to move forward. And so, for instance, last year at our former help, we had discussions surrounding places of education, places of faith, and places of hospitals beyond their wall and how to really strengthen the community. And those robust conversations, they led to engagement of some local hospitals really incorporating plant-based options available for their individuals down in deep south of Alabama. That there was opportunities for education and consideration of incorporating aspects of plant-based nutrition to the education of some of the nursing and LVN students. That we had branches that began to spur up in terms of doing blood pressure screenings at the same time providing individuals with health and wellness information at the same point. And so that's really what this is about. It's about not having lasting change, tangible change, actionable change is what we're really trying to trigger by coming together and having these conversations in person. In person's the key.
Yeah, it is the key. There's nothing better than being in person. I agree. We've got some really good questions here, Columbus, for discussion. So Terrence asked this great question. I'm a primary care PA in an FQHC in a prominently Latino community in Chicago. Patients are working for low wages, high stress, low literacy education levels. Any thoughts on what I can say to folks within the context of a 15-minute appointment with patients with multiple comorbidities to make even small behavior changes? The futility of the situation is quite a challenge. My empathy does not seem to be enough.
Yeah. No, thank you for what you're doing, right? That's not an easy job. That's stressful for you for carrying the burden of caring for individuals and providing care and seeing them struggle and not being able to provide all the solutions. And I think one, addressing their issue and understanding that they are seen and heard is a huge step. But even moving beyond that, I think it's important for individuals to recognize, remember who they are. To steal a line from an old Black Panther movie, right? Remember who you are. And so if we think of what the three sisters of corn and squash and beans and rice and so forth, and going back to the basics, and instead of trying to necessarily eat the American style that may be more cost beneficial, but are reminiscent of foods that perhaps that they have that are culturally relevant foods in an affordable fashion. I imagine you're doing that already in terms of trying to support that. I think back to my parents and my grandmother who was from Louisiana and was born in Charity Hospital. I just thought that was the name. Didn't realize it was a it was for individuals without insurance and no and not having money. But we lived off of red beans and rice and greens. And why was that? Because it was cheap and it was affordable and so forth. And so as you begin to make those processes, even now, I have I've been blessed to have flexibility. My kids say, all you want to eat, Dad, are beans and rice and greens because that's what I grew up on in eating. And so I would encourage you to acknowledge where they come from, as you probably are doing, and find things in their culture that are the most cost efficient and trying to provide as many resources. We're living in challenging times, especially for individuals who may be of different heritage and different backgrounds. And so I think it's so important to provide that support for them as it sounds like you're doing already.
Yeah, thank you, Terrence. That is such a great, important question. One of the things I found through the years too, Terrence, is that, you know, I really try to create a longitudinal conversation with my patients, knowing that I have 15 minutes, but I would say, hey, I'll see you again in 2 weeks. I'll see you again in 3 or 4 weeks. And the first thing I wanted to do for them was inspire them with some hope and let them know that they are supported and that I cared for them and that I was going to walk a journey with them. And, just doing that in the beginning, they opened up. And then I would just share a little bit of information with them. I would help them make like one simple change, and then I would give them a little more information. I would maybe have them watch a documentary, come back and talk about it. And so I just used time to my advantage and seeing that patient over time to help them come along and make those changes. There was a presentation at our conference 2 years ago by Deepa Moody, and she did an amazing job of talking about creating culturally relevant conversations. And she actually works in Chicago area, probably with many of the same population that you're working with. And she has, I think Jill can maybe find her website, but she has some wonderful resources as well for coming along people and helping them to start making changes along that journey. And then I'll just finish with this because Terrence had this follow-up question. It's also a really important one. He said he recently went to a health run forum by a state senator. And the concern was that it's rarely discussed due to fear of putting responsibility on the patients to make behavior changes. It's amazing at the shade that was directed at me for suggesting the concept. Mm. Yeah, and I think, Terrence, sometimes in medicine, we have shamed patients for being non-compliant with, medications and treatment. And there's definitely a bias in healthcare that I think leads to some of that underlying maybe emotion that you're feeling at that event. I'm just remembering in my practice how patients would come to me and they were embarrassed to even talk about diet because they were worried that I was going to shame them, blame them, judge them for, any number of things. And part of that is the diet industry language as well. And I just, I love Maya Angelou's statement, and I would tell this to my patients, and I use it at my immersions all the time. She said, I did then what I knew how to do, but now that I know better, I do better. And that's Maya Angelou. I'm always telling people, hey, I'm just trying to help you learn so that you can do better. And it's such a beautiful concept because there's no blame or shame in that concept. It's what we all strive to do in our lives. It's what we try to teach our children, just to learn better and do better. And along that peaceful journey with loving support and some community around you, all kinds of things become possible. And what we're really trying to do, and one of our goals with the HELP conference is to elevate the inherent value of the individual person, recognizing their value and coming alongside of them to empower them to live a joyful, wonderful life supported by community and healthy food. And so, that would be anything you want to add to that, Columbus?
No, that's great. That's great. I think just continuing to support. I mean, everyone's going to have a perspective, and as Scott mentioned, oftentimes we folks are vilified or situations in terms of blame, as the sole reason, and recognizing that we need to forgive ourselves if there's something to be forgiven for, and move on and learn how to do better and to move from where we're at. And many folks just don't know how. I'll never forget going into various places of faith and educating on nutrition for folks who had never heard it in their life. And I was amazed. I almost kind of like, okay, is someone playing a trick on me? Everyone's heard this, haven't you? Yeah, you don't know about the power of nutrition at all, or you don't know who Dr. Scott Stoll is, or and so going in, I realized the fact that people need to understand, and once they learn, and then not only learn the why, but the how, and begin to make that transition, you start to see the lights come on, and then I give them something that's so important, which is the power of forgiveness to forgive themselves. Because guess what? You're trying to change and transform 20, 30, 40, 50, 60 years of repeated actions within 3 months. That's hard to do. And so doing that, but recognizing that it's so important from a standpoint of health and wellness. And so addressing nutrition from a perspective of health means that I have to titrate the dosage up according to the individual, like I would a medication. I want you at the highest dose, but sometimes that progression takes time for me to get you there. And I have to understand that and recognize that and be supportive to help bring you on this journey.
That's beautiful. I love that. Love that, Columbus. All right, Christine says, what's the best approach to engage patients in initiating dietary change? Is it adding in healthful foods rather than removing healthful foods? What's the best way to begin?
I'll take a stab at it, and then you go. To be honest with you, I don't believe there is one way from my perspective. I think it is an individual based scenario. I have found for the vast majority that most patients do better as I transition and ramp them up. But on the other hand, for instance, a former colleague of mine who retired and sustained heart attacks. Physician heal yourself. Had 2 heart attacks, provide wonderful care for patients, organizationally too as well, and began this journey after I spoke with him on this whole food plant-based diet, and he went all in immediate and has made incredible changes. And we know the tales of what will happen: cholesterol dropping, diabetes reversing, weight loss. That's there, feeling empowered, feeling as if he's 20 years younger, but also dealing with the domino effect of his social life, his marital life, the various aspects of removing something that was a bonding tie to them. And so I say all of that to say is that everyone is so different. So although he had for every success for individuals like him, I've also seen witnessed patients where they have immediately gone backwards after starting off really strong for a week because it wasn't sustainable practice for them. And so I find everyone is different, and I try and gauge it based off of what I call it's not mine, but the readiness index, like how ready is someone for change? What's their commitment level? And it gives me a sense through just conversation about where to engage them and how to move them forward when I'm doing one-on-one coaching or inside of churches or the community where we do our initiatives.
Great. Inspired people make much better decisions than people that are uninspired. And sometimes, my tendency early in my practice was just to give information, disseminate information. this food is better than this food. And so it became very black and white, good food, bad food. And what I missed is that, when somebody is inspired and they have hope, as I the orbital frontal cortex. And that part of the brain begins like strategizing, problem solving, long-term visioning, how to get to a goal. And so what I started doing in my practice before I even got to eat this, don't eat that kind of a conversation was telling a story, about somebody like you've done, telling a story about somebody like them whose life was radically changed when they ate, this kind of general food. And then people are interested and they want to know more. And when they want to know more, they own the information that you share with them. And I found that to be really helpful rather than just, red light, green light foods. And then I also love just telling people what the foods do for them. Like this
Yes.
is you said, these are the blueberries. This is what blueberries do for you. They're like,
That's
wow,
right.
I didn't know that. And so that becomes more of an exciting journey rather than, this hard change journey. We're just trying to put one thing on your plate and take something out. All right, so David has a couple of good questions for us. What's the biggest hindrance to enabling systemic change? Do you think there could be eventual systemic change down the line? And what do you think that could look like? Just a small question in a couple of minutes here, Columbus. Come to the conference because we're going to talk about that.
Yeah, exactly. Make sure you come to the conference. Help conference. Go help thehelpconference.org. But no, in reality, I think that the greatest hindrance to systemic change are individuals. I think that if we have individuals who recognize the importance of lifestyle nutrition specifically, and they begin to clamor for that, they begin to desire it, that their dollars begin to go in that direction, that their voting begins to go in that direction, things will begin to transform. America is built on the idea of choice, and so that choice there needs to be equal choice to have nutritious foods available where I'm at, and there needs to be a clamor for it. That's my as close to simplistic answer as I can give you in a short while.
I think that's a good simplification, right? Because you can get into a large answer. Right.
Yeah.
Once enough people at a groundswell movement begin asking for something, the system starts adapting. Most systems do. So thank you. That's really good. And then David asked a great question. How do you see regenerative organic farming becoming a part of the solution to empowering local communities? You're singing my song, David. I love it. And so, yes, we're actually bringing people into the conference this year. Krista Barfield is a businesswoman who now is turned farmer in Philadelphia, Farmer John. She's the largest private Black female farmer in America. And she is working in the inner cities to grow food and has some really amazing sustainable economic models for urban agriculture to bring about that change. And she also serves with me on the board of directors of the Rhoda Institute. So come and listen to Krista. She's amazing. So you're exactly right, David. If we can begin growing food in these communities, like it changes things on so many different levels. And it can start very simply. It doesn't have to be a large farm. It can be, 5-gallon buckets with a little bit of soil and some basil seed and kale seeds, or growing a blueberry bush, or, you can buy a blueberry bush and donate it to a family. I mean, there's lots of easy ways to start these kinds of projects without a lot of money and making a simple difference just by yourself, doing something to make a difference. So I love that question. Thank you, David.
Yes.
A man named Ron Stoll. I don't know who that is. It's my dad. Thanks for the question, Dad. Do you think that poor nutrition in our country is the root cause of the current Medicaid financial crisis? Columbus, I'll let you answer.
Yeah, when we look at the simple answer is yes, beyond a shadow of a doubt. When we look at the burden of chronic disease that is persistent, and we understand that the majority of chronic disease is nutritionally based, that adjusting our nutrition by effect is going to help. When we look at just take cardiovascular disease, we know that of the heart attacks that happen annually, somewhere around 800 to 900,000, nearly a third of those are from second and third and fourth heart attacks. they're from recurrent heart attacks, that we don't take the opportunity to really instruct individuals on the power of nutrition and lifestyle and transforming their outcomes to decrease it despite so much robust data. Some of the most important data that we have, and you look at the impact that that has in terms of cost and the domino effect in terms of care delivered in the system through traditional therapies. This is the reason why America as a whole is a disparity in terms of health in comparison to other global leaders. You know, so we look at the health outcomes of America, from quality, from performance, despite all of our technology. I mean, literally, we replace heart valves through the groin. We can do incredible things that are you would never think about. We have all this technology, but yet our health outcomes and our quality are so poor. That's because we're missing such a foundational key ingredient. And I believe that that's nutrition.
Yeah, perfect. Thank you. Couple questions, and then we'll wrap it up for the evening. Let's see. So Nicole asks, I recently began as a nutrition educator. Thank you for that work. That is amazing, Nicole. We need so many more.
Yes.
On a community development team. Might I ask your thoughts on using your suggestions on a community scale rather than a one-on-one? And Nicole, I guess I would just ask some clarification because I'm not sure which suggestion you're referencing. So maybe if you can just type that in for us, we can get a little more clarity. While we're waiting for that, next question is from Afua. This has been an excellent discussion. Thank you, Dr. Batiste and Stoll. I'm a preventative medicine, lifestyle, and obesity physician. Are there specific grants you recommend for community-based food initiatives? Do you have any thoughts?
Yeah, you know, I think that that's a challenge for all of us in terms of trying to find continual grants and so forth. So there are several sites that I have found in terms of searching and looking, and whether or not you're looking inside the vegan world, plant-based world, looking under terms like lifestyle and grants, there are some, and the cycles are variable. The cycles on and off in terms of accepting grants. There are some medical centers that actually in healthcare systems that offer grants too as well, especially if it's targeted inside of specific communities. That probably would be beneficial, especially if your thoughts are more or are inside the patient population too as well. So there are several, and that's one of the things we are looking to formulate inside of the health conference too as well, is that having a resource available in time for folks to kind of tap into and to look at, not saying that we're going to deliver money, but in terms of a strategy and approach towards trying to procure grants and funding for your projects that you have. So we want us all to be successful.
That's right. And I would just simply add too that, you know, there are always small projects that we can start that don't require funding. You know, when we started our food outreach, we just did it as a family. We went and spent a little bit of money. We gathered some food, put it in the back of our van, put a table out, and we started simply without a lot of money. As it grew, then we found the resources to help us in helping that to grow. So I just want to like also challenge the mindset that we have to get a grant in order to do a program. And going back to like our kind of initial vision for the help conference is, you know, starting simple and doing something and then growing and moving as you know, we can meet greater needs. And sometimes the money will find you in those cases. So, but thanks for that question. I'm really happy that you're a part of this conversation, especially in your specialty. Before we take our last question, we have a poll. And so I'd like to just ask you all, maybe in the chat, to just answer this question. What is one action you can take starting today to help empower others to, you know, make a healthier choice, especially in maybe communities around you? And one suggestion I'll give you, this is, you know, if you don't know what else to say, it's start a potluck. It's one of the greatest, you know, free tools to start building community, to find resources, and to, you know, gather yourselves to create a bigger impact. So go ahead and type your answers in there. We would love to hear from you. And
while they're doing that, I did want to add, you know, especially for obesity specialist who was commenting a bit earlier, we're excited that we're going to have an obesity specialist at the conference this year, too, as well, who will be speaking, Dr. Sean Hashmi, who's phenomenal in terms of his knowledge and understanding of the interplay between nutrition and health and the impact on not only obesity, but he's also a nephrologist as well as kidney dysfunction. So look forward to seeing you all there.
Yeah, great. Thank you for that. So two quick questions left to Columbus, and then we'll let you get on with your evening. First is, do you have any recommended resources on whole food plant-based eating for SNAP and other low-income households?
Gosh, I end up formulating my own. I don't know of one that's separate that is listed out, but that's a great idea because what I have formulated just briefly is just options of what they can purchase inside of stores that are available nationwide, and large chains and so forth, where they can go and get foods and can and bag and frozen to make things a bit more affordable. Scott, I'm not sure if you know of something else specific.
I don't.
Idea.
We're working on those resources. Dr. Stephen Chen out in San Francisco is working on some nutrition prescription plans. So some of those things are kind of in process and probably, very embryonic at this stage, but you're thinking the right direction. And, I don't know if Jill has any of those, but she might put those in the chat. And so Nicole came back with the second half of that question. So we'll finish with this one, Columbus. And it was how to disseminate the information on plant-based details or concerns on ultra-processed food on a larger scale rather than one-on-one.
Yeah,
nutrition educator, yeah.
Wow. There's nothing better than the power of a story. We've mentioned that already. And I think that's where the power of documentaries come into play. That's where the power of getting folks inspired based off of short clips and videos become really helpful to kind of transmit the information and hopefully addressing. I think that's why there's such an opportunity that goes beyond that. There's different segments of the population who will gravitate towards certain documentaries or films that can touch them and help them push the needle in a different direction. That's probably the easiest way, I would say.
Yeah, that's fantastic. I agree. And to educating wherever we are, the back of an Uber,
That's right.
Always an opportunity to educate. And we do it with love. We do it through inspiration. We do it through the power of the story and our own personal testimony. Those are incredible ways to just keep spreading the message. Well, thank you, Columbus. This has been an incredible conversation. Do you want to give a shout out for the conference?
Yeah, listen, I would love, there's nothing greater than support. So the virtual interaction, and I just see you guys kind of putting information inside the chat, and I'm so just excited, enthusiastic about that. But what I would tell you is that there's nothing greater than coming together. There really is. And I know I'm the same way. Inertia can set in and it's like, I don't know if I feel like going. I would tell you go. And I would tell you come and be a part of change that's happening. And let's stimulate each other. I believe wholeheartedly that iron sharpens iron. And I believe that I will be sharpened by meeting you all and by engaging and assimilating thoughts on ways in which we can push this needle forward and do amazing things. And that's really the goal, is for us to make a change that's lasting. Last, I'll leave you with this one thought, especially as we're thinking about how to get information out there on a large scale. Focus on the power of one, right? And so the power of one, you change one life, you impact one life. That one life then has the potential to impact so many others. And now you have just this is just your tree. They call it the coaching tree. It becomes your coaching tree of all the people that you impact from that one. And you never know what can result from it. So stay encouraged. I look forward. I hope I see you soon at the conference.
Awesome. Thank you, Columbus. And we hope that we see you soon, the HELP conference. And then don't forget the PBNHC, September 5th through 8th.
Yes.
And, we all need to be encouraged. We all need to be supported. We all need to be elevated. And all of these conferences really lead to flourishing. There's There's
Yes.
endless ways to get information online today. You can listen on your phone, there's podcasts, there's journals that you can read, there's CME that you can get online. But I will tell you, there's nothing more important than actually getting together with a community of like-minded individuals, sharing meals, giving a hug, listening together, growing together, and going home supercharged. It's a part of flourishing. It really is a part of flourishing. We're meant to live in community and to grow and to bring about change in empowered communities. And so coming together, whether it's the Help Conference, the PBNHC, or better, both, it's an inspired way for all of us to continue to activate change. And it's my hope tonight that you really heard through the conversation that Columbus and I had, that our vision is not to just have academic conversations about even the science of nutrition. We are really here because we're inspired to change lives, one person at a time, to help our colleagues, one colleague at a time, because we know that's how we begin to build this groundswell movement that the world so needs. So Columbus, my brother, thanks for being with me. I appreciate it. I love you. And thanks to all of you that have joined us live, and for all of you that are watching at a later date. I will look forward to seeing you at the conference. Until then, be well.
Be well.